Hello. I'm going to do hand hygiene. My name is Natalie. I'm from Harper College. Today we're going to be doing a physical assessment. Is that okay with you?
Yeah.
Cool. All right, can you tell me your name, birthday, any allergies?
Angelica Green, 9/27/94. No known allergies.
Great. Can you tell me where you are?
In the doctor's office.
Yes, and then why are you here?
Physical assessment.
Okay, and then do you know who the president is?
President Trump.
Very good. So just based off of that, based off those questions, when I walked in, I noticed her general appearance. I see that she's dressed appropriately. She's oriented to her time, place, situation. She has good cognitive function. Based off of that, she has good speech and communication. She's able to make herself verbalized. I see the color of her skin is appropriate for her skin tone. And then now I'm going to go ahead and verbalize that I'm taking her vitals, her respiratory rate, her heart rate, her temperature, her blood pressure. And then also I'm going to visualize that I'm testing cranial nerve number 2 by doing the Snellen chart. She's going to stand 20 feet away. And then I'm going to test the right eye, then left eye, then both. If your score is 80/20, that means what she sees at 80 feet is what a person can see at 20 feet that is not visually impaired. Yeah. So now I'm going to go ahead and take her height and her weight. She's 5'6", and she's 130 pounds, which means her BMI is 21, which is normal. Normal is from 19 to 24. So that's good. Now I'm going to go ahead and move on to her head and her face. So I'm going to notice that her head is appropriate size for her body. Her head shape is normal cephalic because it is round, which is normal. I'm going to go ahead and ask you to put your head down like this. And then I do see that I'm going to palpate her scalp and looking for lesions, any abnormalities, and her hair is well groomed, which is a good sign. No abnormalities. You can put your head back up. I'm going to go ahead and look at her symmetry for her face. So this is cranial nerve number 7. Can you squeeze your eyes like this for me? And can you smile? And can you frown? Good. And then what I'm looking for is symmetry between that, and her face was symmetrical, no impairment there. I'm going to go ahead and palpate her temporomandibular joint right over here. Can you open your mouth? Good, and close it. And then what I was listening for there was any signs of crepitation, any abnormalities or any pain. Now I'm going to go ahead and palpate your maxillary and frontal sinuses right over here. And then what they should feel is pressure but no pain. Did you
No
feel?
pain.
Okay, now I'm going to go ahead and palpate her ears. So for her ears, I'm going to note the size, shape. I noticed that she has her ears pierced. I'm going to palpate the external auditory meatus. And then I'm going to perform cranial nerve number 8, the vestibulocochlear nerve, cranial nerve, and I'm going to do the whisper test. So tell me what I'm saying.
Blue bench. Yellow t-shirt.
Good. All right, so her cranial nerve 8 is intact. I'm going to go ahead and inspect her nose. So I'm going to go ahead and palpate for any abnormalities. I'm going to look for any lesions. Do you have any pain? Okay, I'm going to go ahead and ask you to cover one nostril and breathe in. And then take the other nostril and breathe in. And did you feel any trouble?
No.
Okay. So now I'm going to go ahead and that's testing the patency. Now I'm going to go ahead and inspect her mouth. I'm going to look for cracks, any lesions. Can you open your mouth? I'm going to look at her buccal mucosa. I'm going to look at her lung, her gums, her teeth, her frontal, her upper plate for the mouth, and then the lower, and then under the tongue. When that is all pink, I want to look for moisture, any signs of abnormalities, and I don't see any. So now I'm going to go ahead and ask you to go, Good. So I do see that her tonsils are in place and her uvula moved, which means cranial 9. Nerves 9 and 10 are intact. And then I'm going to ask you to stick out your tongue. And when she stuck out her tongue was midline, which means cranial nerve 12 is in place. So now I'm going to go ahead and, now I'm going to go ahead and do her ears, her eyes. So I'm going to grab this pencil and I'm going to test the 6 cardinal gazes. So go ahead and follow my pencil with your eyes. I'm going to go slow. And what I'm looking for is that her eyes are following the pencil, and I'm going to look for any signs of nystagmus, which is shaking of the eyes when they're close together, which I did not see. And then I'm going to go ahead and ask you to follow the pencil again. I'm going to bring it in and bring it out. And what I saw is that her eyes were following the pencil. They crossed and then they went back out when I brought the pencil out, which is great. Now I'm going to go ahead and test the pupillary light reflex. This is cranial nerve 3, 4 and 6, you can go ahead and put on the light. If it was a dark room, it'd be ideal, but for right now, this is what we have. And so I'm going to take the light and I'm going to move it into the patient's eye, and I'm going to look that her pupils are reacting to the light and getting smaller. So I'm going to separate the eye. I'm going to, please don't look at the light, just look at me. And I'm going to note her pupils, and they're getting smaller, which is great. And then again, her pupils are reacting to the light. So in the chart, I'm going to note PERLA, which is pupils are equal, round, and reactive to the light and accommodation. Great. Now, I did the eyes. Now I'm going to go ahead and note her sclera and her conjunctiva. So I'm going to look at her sclera. It is china white, which is appropriate for her body. And then I'm going to ask you to look up, and I'm going to note the conjunctiva is pink and red, which means there's good blood flow to the eyes. Great. Now we're going to go ahead and move on to the neck. So first thing we're going to do with the neck is I'm going to palpate with my 2 fingers carotid arteries one at a time. Good, and the rate is 2+, which is normal. If they were bounding, it'd be 3+, and then if they were not there, it'd be 1 or 0. Now I'm going to go ahead and use the bell of my stethoscope and listen for any signs of bruits. You can go ahead and breathe with your mouth. Great, and I did not hear any bruits, which is normal. You should not hear any bruits. Now I'm going to go ahead and go into the lymph glands. Yeah. Now we're going to check for glands. So this is the preauricular. I'm going to use the pads of my fingers. Preauricular, right over here. Circular motion. Postauricular, right over here. The occipital, right behind the ears, not down by the neck. Occipital. Now the submental, right over here. This is the submandibular. Jugular-digastric, right over here. Superficial cervical, right over here. This is the deep cervical chain, right over here. And then I'm going to note the post-cervical, which is you can put your head down. I'm going to feel it in between the spine and the back of the neck. And then I'm going to, the subclavicular ones right over here. You can ask your patient to shrug. And right in that crevice, I'm going to go ahead and feel for the glands. You shouldn't feel anything if they were big. They would be enlarged. Good. So also right here, I'm going to feel for the parotid, salivary, and the thyroid gland. So parotid is right over here. I'm going to know for any swelling. Do you feel any pain, swelling? No. And the thyroid gland would be right over here. There's no indication of enlargement or anything like that. Now I'm going to note the range of motion of the neck. So I'm going to ask you to look up and look down, and then put your right ear to your right shoulder, left ear to the left shoulder. Good. That is a good range of motion. Now I'm going to go ahead and listen to I'm going to move on to the respiratory. So I'm going to ask you to take off your sweatshirt. Great. So what I'm going to do is first take note of her skin. It is appropriate for her ethnicity. I'm going to note the rates, the rhythm that she's breathing at. I'm going to see if she's using any accessory muscles, which she's not, from the anterior region. She's breathing comfortably, and I'm going to look at the posterior region. And again, she's breathing comfortably. I don't see any signs of struggle. So now I'm going to go ahead and use the diaphragm of my stethoscope. I'm going to listen to her lung sounds. Can you just go over here? I'm going to start at the apex, and we're going to go fastly through this, but we're going to pretend that each time I move my stethoscope, she's breathing in and out, and then I move it, and breathing in and out, and then I move it, okay? So she's breathing with her mouth and out with her mouth. So start with the apex, great, and you don't have to actually breathe that fast. I'm going to go to the second intercostal space right over here, and I'm listening for S1, S2 sounds. I'm going to go under here, and I'm going to feel it right here. And if I would ask them if they would want me to slow down. No battery. Okay. I would ask them if they want me to slow down, and I could if they wanted to. You don't want your patient to get passed out, especially if they have respiratory issues. All right, great. Now I'm going to listen to the posterior side. A little bit more. Okay, so I'm going to start off with the apex right over here. And then I'm going to move in right over here. And you don't want to listen on top of the scapula, and you want to always always listen to the directly on the patient's skin because otherwise the sounds can get distorted. And each time I'm moving my stethoscope, she's breathing in and out. Great. Now, since the right lung has 3 lobes, I'm going to listen to the 3 areas. Right side. Face a little bit more. So I'm going to listen to the right 3 areas, which would be right here, right here, and right here. And then the left has 2, so 2 areas that we're listening to right there. Great. So now I'm going to go ahead and ask my patient to sit at a 30 to 45 degree angle. So what I'm looking for is, can you put your head in like this? So what I'm looking for is jugular venous distension, which I don't see any, which is a normal finding. If you do see venous distension, it's a sign of respiratory issues that they could be having. Great, looks good. So it is flat on both sides, which is normal. Go ahead and sit up over here. For now. Now I'm gonna go ahead and do the upper extremities. So I'm going to go ahead and look at the skin tone, which is normal for ethnicity. I'm going to take the back of my hands, feel the temperature, which is good. I'm going to take my fingers and feel the radial pulses right over here. Good, they're even, 2+. And then I'm going to go ahead and note the capillary refill on each finger. Should be less than 3 seconds, which it is. Great, I'm going to look at the profile sign of the finger. I'm looking for clubbing, which would be indicative if the angle was over 180 degrees, which it's not. It's good, it's normal. Sorry. It's normal. It's not more than 180 degrees, which means no clubbing is present. Okay, now, so we did the upper extremities, we did breathing. So what I was looking for when I was listening to the breathing, I was looking for, I heard bronchial sounds right over here, which are high-pitched. I heard vestibular bronchial noises in the mid-thoracic area, and then I heard vesicular noises, which are low-pitched in the lower area of the lungs right over here. So now I'm going to go ahead and move on to the heart. So I'm going to go ahead and take the diaphragm of my stethoscope and listen to the apical pulse for 60 seconds. I'm going to note the rate rhythm, 60 seconds. Great. 60 seconds past, her heart rate was 64, which is normal. Now I'm going to go ahead and take the diaphragm of my stethoscope and listen to the aortic, pulmonic, tricuspid, and mitral areas of the heart, of the arteries. So I'm going to go ahead and be listening to the diaphragm of my stethoscope. This is aortic, pulmonic, tricuspid, and mitral, right there. I'm going to use the bell of my stethoscope to do the same thing. Aortic, pulmonic, tricuspid, and mitral. And I did not hear, I'm listening for bruits. I would be listening for longer, obviously. I'm listening for bruits, which would be abnormal. You don't want to hear anything when I did not hear anything, which is really good. Now, we're going to be moving on to the abdomen, so I'm going to have you lay down. So first I'm going to note the skin tone. I'm going to look for lesions, abnormalities. I'm going to note the umbilicus, which is normal. And I'm going to note any pulsations. Pulsations are present in children and very skinny adults. You can see the aortic pulsations. I'm going to use the bell of my stethoscope and I'm going to listen to the aortic artery and then the renal artery, which is to the side. It's so hard going fast. The aortic right here and then the renals on the here. And I'm listening for bruits, which could be a sign of insufficiencies. You don't want to hear anything and I did not hear anything. Now I'm going to go ahead and take my stethoscope and with the diaphragm, I'm going to go ahead and listen to each of the 4 quadrants. I'm going to start in the upper right quadrant and then make a circle. I would listen to for 5 minutes for each quadrant if I did not hear anything, which for bowel sounds. Great, bowel sounds present in all 4 quadrants, which is great. You can ask them when they last had a bowel movement. Now I'm going to use light palpation. I'm in a rotary motion, and then I would ask them if they feel any pain or discomfort.
No.
No, and now I'm going to go ahead and use deep rotary motions.
No.
You can find abnormalities in the organs that way, things like that. Okay, so before that, I would notice the size and the shape of her abdomen. So I notice that it's flat. I would look but symmetrical from both areas of the bed, which is great. Good. Now I'm going to move on to the lower extremities. Again, I'm going to notice the skin tone, which is appropriate for ethnicity. I'm going to take the backs of my hands and notice the temperature. Great. Warm to the touch. I'm going to go ahead and do range of motions. I'm going to take your knee, flex it, extend it, flex it again, and move it out, and move it in for the hip, and put it down. Again, with the other leg, go up, down, and flex it, up, and then note any pain? No? Can you lift up your legs for 5 seconds? 1, 2, 3, 4, 5. Great. 5 seconds. 1, 2, 3, 4, 5. Great. Can you go ahead and push down on my hands? Great. This tests the strength of the ankles. Push up on my hands. Great. Now I'm going to leave your heels right there. I'm going to move your feet towards you. Good. And then I'm going to move them out. Great. Now you can go ahead and stand up. I don't know if I tested the range of motion on your hands. In your arms, did you?
No.
Okay, so for the range of motion on the arms, I totally forgot. So I would ask her to flex her elbows and deflex them, and then you would do a rotary motion. Great. And then I'm going to ask you to do pronation, supination, close your arms, like this, and then spread your fingers, and then close your fingers like this, and put them down, and put them up. Great, and then I want you to squeeze my fingers as hard as you can. Great, and then I want you to put your hands like this, and then bring me closer to you. Great. That's the strength of the elbows. And then you would do abduction, so bring them away, and then adduction, bring them closer. Great, good job. And let's do the same thing on your legs for the abduction and adduction. Yep. So, abduction, adduction, same thing, abduction, adduction. Move them away and then move them closer. I'm going to do the Babinski reflex on you. So I'm going to take the pen. Can you shift this way?
Yeah.
So they can see. So I'm going to take my pen and move it sharp like this. And what I'm looking for is the curling of the toes, which is a normal finding. If the toes went up, that's kind of an indication that there could be an abnormality. Great. So now we're going to do neurological. So I'm going to grab something soft. So now I'm going to ask you to close your eyes. Tell me when I'm touching you. Say now.
Now. Now. Now. Now. Now. Now. Now.
Great, good. Now I'm going to do the sharp and the dull reflex. So I'm going to, this is dull and this is sharp.
Mm-hmm.
Tell me when I'm touching you if it's dull or sharp, okay?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Great, good job. So now that is good. I'm going to test your cerebral function with the nose to my nose, with the finger to the nose test.
Okay.
So I'm going to ask you to follow my finger. Great, and then back to your nose. Great. Good job. Okay, good. Now I'm going to go ahead and test your deep tendon reflexes, your biceps. So go ahead and put that loose right here. And I'm going to hit right over here. I'm going to look for the movement of the arm, which is good. I'm going to go ahead and hit right over here. And I'm going to look for the movement of the arm, which is good. Now the legs, I'm going to go ahead and hit right over here. I'm looking for the pulsation of the knee, which is good. And if they were unable to grab that reflex, you would just ask them to close their hands like this and distract them. Maybe if that will help. What else? Oh yeah. So can you go ahead and stand up for me? Okay, I'm gonna ask you. Sorry. I'm gonna go ahead and ask you to walk to the door, and then great, just normally. Great, I'm observing her gait. Now I'm gonna do the same thing with knee, with the heel to the toe. Great, good job, and walk back with me. Fantastic. Now I'm gonna ask you to take your heel and slide it on the front of your shin. Great, good, good job. Now I'm gonna go ahead and perform the Romberg test on you. I'm gonna stand. Oh no, that's okay. Romberg test right here. We're going to close your eyes. I'm going to put my hands right here. For 20 seconds, we're going to test your balance. I would be right here just in case she's falling. All right, 20 seconds passed. That is the negative Romberg test. So that's good. It's normal. So you can go ahead and have a seat. No, oh, you know what? Sorry. No, you can't. Now I'm going to go ahead and test I'm going to look at your spine. So I'm going to look at go ahead. You can stand up straight.
Okay.
I'm looking that this is convex over here in the thoracic and the cervical area, and then the concave on the lumbar area, so it's like this and like this, which is normal. Now what I'm looking for symmetry is symmetrical shoulders, the scapula, and the gluteal folds for the symmetry. Now no indication of spine deformities. I'm going to go ahead and ask you to bend forward. What I'm looking for here is the C curvature, which I do see, and then over here, which is symmetrical from that area. Looking good. Okay, so now I'm going to do range of motion of the spine. Put your hands on your hips and go to the right side and go to the left side. And now without moving your hips, turn to the right and turn to the left. Good. Go ahead and have a seat. Trying to think if I missed anything. I think we made it under 23 minutes. Yeah, 20 minutes right now. I looked at your mouth.
I think you got it all.
Okay. Hopefully that's it. Bye.